My name is Zvi Small. I'm a board-certified plastic surgeon. I've been practicing plastic surgery in Bergen County for 20 years. Breast reduction surgery is when we reduce the overall volume of the breast to make the breast smaller, and we also lift the breast to make them more round and youthful looking. Breast reduction surgery is actually my favorite surgery because it has instant results, instant gratification with very minimal downtime. It's one of my favorite operations to do, and we find that afterwards patients become a lot more active, and a lot of patients lose weight afterwards just because they feel more comfortable in their own clothing and they can be more active, whereas previously with their large breasts they weren't able to do certain activities that they can now do. Typical complaints people have who are seeking breast reduction surgery is large pendulous breasts. Very frequently they're unable to perform sports or other activities they want to do, skin irritations and rashes underneath their breasts, or just an overall self-confidence. We have a lot of young girls who walk around hunched over. They just feel so embarrassed of their breasts that it's socially stigmatizing for them. Those are the kind of things that we typically see for patients who are seeking breast reduction. The best option for people who have large breasts is breast reduction surgery. While some people do offer liposuction breast reduction can reduce the volume of the breast, but it doesn't improve the contour and shape of the breast. So we really perform that only as an adjunct to breast reduction surgery. But breast reduction surgery is very straightforward, instantaneous results with very little downtime. I always joke around by saying the biggest regret people who undergo breast reduction surgery will have is that they didn't do it 20 years earlier. My favorite age to do it is when people in their teenagers, at the end of high school, their breasts have stopped growing, they've stopped buying bras. That's when we know their breasts have reached their final shape and size. And we do the breast reduction surgery and it changes the young woman's life. She feels so much more confident and she goes on to college or goes on to work feeling so much better about herself, and very frequently loses weight because she's more active. Moms who've already had their kids who want to have their breasts reduced also is a big area, a big patient population of ours. And the older patients who do it, the biggest complaint that they didn't do it 20 years earlier because the results are instantaneous and the downtime is very minimal and you could resume all your normal activities immediately. The breast reduction surgery entails marking the patient prior to surgery, and then I joke around and I say I'm cutting on the dotted lines. We preserve a blood supply to the nipple as we remove extraneous or redundant tissue, and we raise the nipple to a more youthful position. There are typically no sutures that have to come out, and the patient's placed in a bra afterwards, and we wrap the bra with ace bandage just to keep the swelling down, and traditionally there are no drains as well. On the day of surgery, the patient is marked prior to surgery. She goes into the room, and once she's asleep, we begin our operation. Surgery, it takes, depending on how large the breasts are, between 2.5 to 3.5 hours. And she wakes up and is in the recovery room for about an hour before she goes home. And since we numb the chest up, we anesthetize the chest with an anesthetic that lasts 3 days, there's typically no pain. The best outcome I could describe of breast reduction surgery is happiness. And that's because the results are instantaneous, downtime is minimal, and the sense of restored self-image is immediate.